Dr. Helen Hosker, Urgent Care Lead for Central Manchester Clinical Commissioning Group. Certainly, I think there are three themes that have kind of remained with me. First of all, about how you deal with difficult data, and I suppose that's been a frustration that the mature approach that I heard taken by someone senior at Stanford Medical Center isn't necessarily replicated in our culture, where we have league tables, we have ratings and arguments about the data, quality of data. So that's been a disappointment, and realizing that actually there are more mature ways to go about it. But I think the nature of the culture that we're in and the performance targets and everything, it's just so many of them, that which isn't the same in the United States, that people automatically go into that groove. But instead of thinking, actually, yes, the data may be wrong, but we could still learn, and looking and challenging, saying how can we improve our processes, and actually using it as in a positive way. So that's disappointing, but everyone's so busy and they have so many performance targets and numbers coming at them. I think that's almost an inevitability. I think one of the other areas was about integration, about organisations working together, and they haven't able to do that in a different way in the United States. I think for me it's about, in the work that I do, it's about integration between health and social care, which they can't do in the United States. And certainly I was interested in that and doing work on that before I went to the States. And the thinking has been developing with the acute trust, with social care, with community services, and trying to engage primary care in that as well. Not in the same medical model, but in a different health and social care model, and that's going well in lots of different ways. From the top down, there's an agreement that we're going to work towards that. So that was really helpful and really helped me formulate my thinking when I was in the States. And the other one is about different ways of delivering long-term conditions and joining up care, particularly using technology. So those are the three main themes I suppose have stayed with me in practical terms, although some of the bigger picture stuff you keep in the background and kind of seeing things in a different context. For those of us on the ground, the biggest challenge is the workload and the resources to do it. And for those of us who've got lead roles, the amount of change that's required, and then actually getting on and delivering the day job, and the ever-increasing day job, with all the cutbacks and the need to save money and keep people on board. So that's really hard. I think it is, what we don't want is to be burdened with the academy with something that is just more onerous and more demanding on us, that's supportive. I think one of the key things is networking with colleagues. I mean, my area of urgent care, patients don't follow normal boundaries rather. And so you need to know what everybody else is doing and work together. For me, that's happening because I have to work with colleagues in two neighbouring clinical commissioning groups in North and South Manchester in any case, but also the Acute Trust is acquiring Trafford Healthcare Trust. So I'm liaising with colleagues in Trafford as well. So there's a need to kind of recognise that we're all in a system together and learn what people are doing, share good ideas, what didn't work, and support one another. So I think those are the sorts of things. I think it's, yeah, we're all getting more selective about what meetings we go to, and we don't want to go to meetings for the sake of meetings, because we all have day jobs to get on with, and that's going to be a real challenge over the next few years. I would certainly recommend it because there isn't anything else that I'm aware of that can support leaders in the Northwest. I think, having the opportunity to go on such a high-level program was really interesting and really useful, and has been really informative. I think coming back and working through it, as I said, support, the mentoring. We had a bit of mentoring beforehand, but that didn't work out quite so well. So I think it's the mentoring and support afterwards, and meeting, specific areas of need that we might have identified to grow us as leaders and give us the skills and knowledge that we need. But particularly developing leadership skills, because the clinical skills and things come elsewhere, and you get the knowledge, but it's some of those other leadership skills about influencing, how you get things done, different ways of working, that I think are really going to be really key.